Yeah, so it's about stopping the spread of STIs, and it's about catching them early. So if people get tested when they haven't got any symptoms or when they have got very mild symptoms, we can stop that, we can test their partner and treat their partner, and then we've stopped the spread of that STI moving on. So that's why it's really important, because when people, if we can stop the spread, then we can lower the background incidence. No, so you wouldn't need to come for screening if you haven't had
signs of okay.
Yeah, so no, so you could come if you're asymptomatic, but we would want to know what your risk is. So, for example, if you have had a sexual partner and you still haven't got any symptoms, it's still worth being treated. But if you've been in a monogamous relationship for a long time, then so just with one partner, and that partner's not having sex with anybody else as well, then you can be sure that there's no STI, because it's not going to come out of nowhere. They're passed around, okay? So the best thing that you can do to protect yourself is that you should use condoms when you're having sexual intercourse. So condoms prevent STIs being spread. It doesn't completely stop them, but it will lower the risk significantly. You can limit the number of partners that you have, so that will help reduce the chances of you getting sexually transmitted infections. But also now we have vaccination, so you can be vaccinated against HPV, human papillomavirus. So we spoke about that last week, and so we know that you can lower the risk of getting HPV. So then that will stop you from getting genital warts, stop you from getting the virus, stop it from spreading, and stop you from getting cervical cancer, or help lower the risk anyway. There's also a vaccination against hepatitis B, and then we also have what's called PrEP and PEP. So we have pre-exposure prophylaxis medication, which we can give to people that they can take that medication before they have sex with people who've got HIV to prevent them from getting HIV. And then we have a different type of medication which you can take after you've had sex with somebody who's got HIV, and then you take the medication after you've had sex, and that stops the HIV from developing in you. So we know we've got these medications that work very well. So that's also something that can be used. So you can get HIV from blood to blood transfer, or you can get it from having sex with somebody, and that's how it's transferred. So you need to have a certain amount of the virus in you to be able to transfer it. So nowadays, if someone is on antiretroviral treatment and their viral load is undetectable, then they can't transfer that virus on. So we would want somebody to be undetectable on medication, and then even if they have sex with somebody, then they can't pass on the HIV. So there is a possibility if they've had blood-to-blood contact that they could pass on HIV like that. But I wouldn't be able to comment on individual cases.
Okay.
So we have a big problem here because we don't have the tests to know exactly what we're treating, and because lots of people are asymptomatic, so they have no symptoms. So we tend to treat what's called syndromically, and what that means is we look and we see what we think it is, and then we treat depending on what it is, what we think it is. But that's very difficult because you may get it wrong and you may not be able to see anything because there's no symptoms at all. So I think it's really difficult here to know what we are dealing with. Now, if you get diagnosed with a sexually transmitted infection, we always want to make sure that your partner is treated and tested and treated as well, and that you don't have sex with them until you've both completed treatment. Otherwise, it just gets passed between the two of you. And so we have look-back periods where we look how many people have you slept with in the past, say, 3 months, or depending on what STI it is, and then we want you to contact all those partners so that they can all be tested and treated if there is multiple partners. Bacterial STIs are easily cured with antibiotics. So if you had chlamydia or gonorrhea or syphilis or mycoplasma, we can treat those using antibiotics, and then that is completely cleared from your system. And that's why it's really important to get tested, because we have a cure for it, okay? When we're thinking about the viral STIs, they can be a bit more difficult to treat. So HPV will often be cleared by your body on its own, And genital warts can also be removed with either cryotherapy or with different liquids that we can paint onto them. If somebody has HIV or hepatitis, they would need to go on to long-term medication. But now people can lead long and normal lives on the medication. And hepatitis C can now be completely cured as well with medication. So it depends on what STI you've got. So the parasitic STIs that I mentioned, so the ones that are like the pubic lice, again, easily treated, or scabies, easily treated as well with medication. So really the ones that are more tricky are always the viruses. So HIV, the more serious ones would be HIV and hepatitis. And if syphilis is not treated, then it can end up being quite serious down the line. But they're the ones that would affect you long term and affect your body. Herpes can be difficult for people to manage because they have a flare up and then it goes away and then it keeps recurring. But usually the recurrences get less and less. So that's with the genital ulcers disease. And then the bacterial ones are easily treated, but if they're not treated, then they can lead to things like the pelvic inflammatory disease and the infertility. So all of them have different problems associated with them that we need to take into consideration. So very rarely, well, if you had an ectopic pregnancy, so if you had one of the complications associated with the infection, and that led to an ectopic pregnancy, then you may need surgery. And also if you had one of the STIs while you were pregnant and you miscarried the pregnancy, that may lead to you requiring surgery. So cervical cancer is just caused by the HPV virus. Most of it's caused by the HPV virus. So that's not related to the other things that you mentioned. So the bacterial STIs we would be able to treat very easily, so like chlamydia or gonorrhea and syphilis. And then the herpes, if it was a first outbreak of herpes, we'd be slightly cautious about you delivering the baby vaginally. So we may want to do a cesarean section depending on whether it was the first episode. And that's because when the baby passes through the genital tract, the baby can pass by the open ulcers, the lesions, and then it can transmit onto the baby, and that can lead to lots of complications for the baby. So we wouldn't want to put the baby at risk in that situation. So I think that the biggest misconception I'd say is that people always think it won't happen to them. And so I think it's that somebody can be asymptomatic, so have no symptoms and still have an STI and not know about it. And I think that I see, people often think that they need to have multiple partners to get a sexually transmitted infection, but it just takes one partner to have sex with who's got an STI for you to catch it. So it's about looking after yourself as much as you possibly can. So insisting on condom use, and making sure that you protect yourself as much as possible. No, so the STI has to come from somewhere. So if you're in a monogamous, so if you're just in a relationship with one person and neither of you have an STI, then it doesn't just come out of nowhere. So it has to be passed on from somebody to somebody to somebody. But if somebody's had, somebody could have had partners in the past and then be a carrier of an STI, but not know that they're a carrier of an STI, and then have sex with you and then pass it on. So you see, you often don't know where the STI came from. So the World Health Organization has some really good resources on sexually transmitted infections, which you can read. And also the British Association for Sexual Health and HIV has some really good patient information leaflets. So it's really good to go to sort of renowned sources to read about these things, because often there'll be lots of misinformation on the internet. So the big things would be that you can get vaccinated for hepatitis B, and you can get vaccinated for HPV virus, and that will reduce your risk of getting those. You can use condoms and limit the number of sexual partners that you have. You can get tested regularly so that you know that you don't have a sexually transmitted infection. And if you are having sex with people who may have HIV, then you can use PrEP medication or PEP medication, depending on the viral load of your partner. So they would be the big things that I would say. I would say use condoms for that, because you often won't know what risks you're taking. So using a condom is going to prevent most STIs, or definitely significantly reduce your risk of getting a sexually transmitted infection. Yeah, so sex workers, we would recommend that they were probably using PrEP, so pre-exposure prophylaxis against HIV, so that they had a much lower risk, because often sex workers aren't able to negotiate using condoms, so they would be at a much higher risk of getting HIV. So we would want to make sure that they're on PrEP. We would also want them to get vaccinated against HPV and hepatitis. And then we would also just recommend that they try and negotiate condom use when they're having sexual intercourse, but obviously that's very difficult. Yeah, so I think that you can definitely come and talk to me in a clinic if you wanted to, or talk to a doctor about sexually transmitted infections. There's absolutely no shame involved with sexually transmitted infections. As I said, lots of people don't even know they've got them. We want people to be having a happy and active sexual life. That's about being a person and about finding out who you are. But we just want you to be as careful as possible while you're doing that. So try and navigate condom use, try and make sure you're getting regular screening, open up the conversation with your partner about screening before you have sexual intercourse with them to make sure that you're both negative for sexually transmitted infections. Screening, so it completely depends on how much you're working. So for like a chlamydia and gonorrhea test, it usually takes 2 weeks to show up if you're doing what's called a NATS test, which are available in some places here. If you're doing an HIV test, an HIV test takes 6 weeks to be positive, or some of the finger prick test can take longer, up to 3 months to be positive. So we would say get checked regularly, so either monthly if you're a sex worker, or every couple of months if you're a sex worker, to make sure that you're looking after yourself.